Hello everyone, welcome to Dentospedia, one of the best platform for global dental board exam to simplify dentistry for students. And today I am going to give you a short lecture from endodontic module, that is the local anesthesia. So let us begin with the chapter. So local anesthesia is one of the most important topic in principles of endodontic treatment. So let us understand some basics. The local anesthesia is essential in endodontics because it eliminates the pain during the pulpal and any periradicular procedure management, and it helps us to take a proper care during management and create a stress-free environment for both for the patient as well as the operator. So let us see what is local anesthesia. It is essential to eliminate the pain during access opening, that is the first step of the root canal treatment, or any instrumentation or irrigation. So these are the steps which are followed in the root canal treatment, and in these steps the local anesthesia helps us to eliminate any pain. So it reduces the patient's anxiety, also improves the patient's cooperation, which is very much needed, prevents a sudden movements, that is it improves the operator control and also accuracy. And it is also required even for the necrotic tooth. So even for the necrotic tooth, even if the tooth is non-vital, it is required because the pain may happen during instrumentation or irrigation. So in the process during irrigation or any instrumentation which is done during root canal treatment, the pain may occur, and so it is also needed in any necrotic tooth. So the commonly used anesthetic agents are 2% lidocaine with the epinephrine, and which epinephrine is a vasoconstrictor, which is the most commonly used because of the predictable onset and the depth. Now you have to remember this commonly used local anesthetic agents, that is 2% lidocaine or 4% artricine with the epinephrine. It is an alternative with high success in both infiltration as well as supplemental injections. So these are given as an alternative to this lidocaine, which has high success rate in both case if it is given in infiltration or any supplemental injections. Both are the standard agents for the routine endodontic therapy, and these 4% artricine, which is the buccal infiltration, is given in the hot tooth. Very important from exam point of view. So we'll see the techniques of LA in endodontics. Infiltration is given, this type of technique is given in the maxillary teeth or in mandibular incisors. While inferior alveolar nerve block, complete block is given in case of mandibular molars or premolars. So in the case of mandibular posterior teeth, the block is given. Now there are some supplemental techniques which can be given. There is intraligamentary injections, intraosseous injection, intrapulpal injections for the hot tooth, mental or incisive block, PSA block. For the hot tooth, what is a hot tooth? Is a tooth which doesn't get anesthetized easily. So tooth which gets failure to anesthetize, suppose you have anesthetized the tooth and the patient is already again complain of pain, that means the tooth is unable to anesthetize, and this tooth is known as hot tooth. It is one of the endodontic emergencies. And the combination here, so the combination of inferior alveolar nerve block is given, plus the buccal infiltration, plus the intraligamentary, and this combination is very effective for hot tooth. It is very important. We have studied this in detail in Dentospedia, one of our chapter in endodontic emergencies. So the reason for the failure of the anesthesia, first is the low pH of the inflamed tissue, which causes the anesthesia cannot ionize properly. So in the case of low pH of the inflamed tissue, this causes the anesthesia cannot ionize properly, and accessory nerves like mylohyoid or contralateral incisive branches, they also causes the failure of anesthesia. Inaccurate needle placement or insufficient volume of anesthetic agent given. Now please understand very important thing here. The lip numbness, that doesn't mean the pulp anesthesia is always right. So if the patient you have given the anesthesia and there is lip numbness, you can see, and the patient is still complaining of anesthetic pain. Now the patient is complaining of the pain. That doesn't mean your anesthesia has worked out. So the lip numbness is not a clinical characteristic of any anesthesia. But if there is absence of lip numbness, that means there is no lip numbness, that is for sure is a failed block. So if the patient is not having any lip numbness, that means it is a failed block. But if the patient is having numbness but still it is complaining of pain, that means you may require more anesthesia. It doesn't always say that the pulp anesthesia has been given. So the statement is the lip numbness is not always equal to pulp anesthesia, but the absence of the lip numbness is equal to a failed block. So thank you so much for listening. For the entire chapter along with the MCQs, flow chart and diagrams to understand the chapter better, you can download the Dentospedia app today. Thank you.